Hi there, it's Dr. Leslie. Welcome to another episode of Triggered with Dr. Leslie. So this is where I rant and rave about some of the ridiculous migraine reels that are out there on social media. So today we are back with Dr. Painkiller. If you've been following this series, this guy really triggers me. So we're gonna take a look at one of his latest.
Why do some migraines vanish right after you throw up? The answer is wild, and it's the same reason.
Okay, so he's saying, talking about the observation that sometimes vomiting, people will feel a lot better after they vomit, right? So, nausea, it's a very common migraine symptom. And many times people will feel better. The migraine will start to lift if they can manage to vomit. Now, this is a tough one because a lot of people will do everything possible to not vomit. Right? It's like a lot of people say, I haven't vomited in 20 years because I don't let myself vomit, no matter how nauseous I am. Another factor is because nausea is such a common migraine symptom, a lot of people with migraines are given anti-nausea medications to take along with their migraine abortive medication to relieve that symptom. Nausea, it's a horrible symptom. Oh my gosh. A lot of times, people would rather have the head pain than the nausea. So it's one of the absolutely more common migraine symptoms that comes along with the head pain. And like I say, it's a terrible symptom. Nausea is a real drag.
And why an expensive device works. Here's what's actually happening. Vomiting is one of the most powerful natural activators of the vagus nerve.
Okay, so here we go with the vagus nerve talk. Okay, so the vagus nerve talk is very prominent in the migraine community. So he's saying that vomiting stimulates the vagus nerve. The vagus nerve is what's called a cranial nerve. So it's a nerve that's coming right out of your brain through the brainstem, and it innervates your internal organs. So this is different than a spinal nerve that's exiting and going into your body through the foramen or the opening between your vertebrae. You have 10 cranial nerves. So there are 12 cranial nerves that are not coming out through your spine. So the vagus nerve is one of them, and it innervates your internal organs, including your stomach,
which connects your gut directly to your brainstem. That vagal signal lights up a relay station called the nucleus tractus solitarius, which triggers a release of norepinephrine and serotonin, which suppresses the trigeminal pain pathways that drive migraine.
Okay, so here he's talking about, neurotransmitters, and he's making a claim that these neurotransmitters are suppressing the pathways within the trigeminal nerve that drive the migraine. So this is a hypothesis. Officially, they really don't know the biochemical or the physiological cause of migraine. It's considered to be sort of a medical mystery as to what causes migraine. So he's kind of stating this pretty definitively, and I would say that is a hypothesis within the conventional model. Hi there. I want to jump in real quick and tell you about my client Beth. She was getting 15 to 20 migraines and headaches per month. And as you can imagine, this was impacting her work performance and her confidence. She also has 2 small children, and she was starting to feel like she was a horrible mom because she had nothing left for them at the end of the day. But she reached out and she booked a free consult call with me, and after I asked her about her migraines and her health history, I felt confident that I could help her. I help women uncover the root drivers of their migraines and follow a step-by-step plan to dramatically reduce the frequency by up to 90% without adding more medication or taking a bunch of supplements. So we built her personal migraine map, followed the plan, and now she will get 1 to 2 migraines per year, which she uses ibuprofen to treat if she needs to, versus up to 15 to 20 per month when we first started working together that weren't responding well to any medication. She just reached out to tell me that she got a promotion at work, she's on top of her career again, and has been able to come off all of her migraine medication. But most importantly, she's a confident mom again, and she's attending birthday parties at Jump Zone with her kids and saying yes instead of saying maybe later. I've worked with women like Beth from all over the United States who were told, this is the best we can do, but they were still willing to dig deeper. So if you're serious about changing your migraine story, go to drlesliecaesar.com/apply or tap the link in the show notes, and on our free consult, we'll map out why your migraines keep coming back and the first 3 steps you can take over the next 30 days. I do cap new client spots each month, so if the calendar is full, the doors are closed for now. But if you're done feeling helpless and ready to do the work to heal, pause this episode for 30 seconds and book that consult call now.
In other words, your body just performed a crude version of a vagus nerve stimulation, which is an FDA-cleared migraine treatment.
And so what he's saying is that that whole process is very similar to doing what is called vagus nerve stimulation on yourself. Okay, so there are different devices that will stimulate the vagus nerve, basically send more sort of input into the nerve. You could think of this as if the nerve is a little bit sluggish, you're adding in a little bit more like voltage, energy to the nerve. And so what he's saying is that vomiting kind of recreates that. The process of vomiting recreates what a vagal nerve stimulator would do, or a vagus nerve stimulator would do, like a cephaly device.
For obvious ethical reasons, no trial has randomized patients to vomit versus no vomit. The evidence is entirely observational and patient-reported. But
yeah, so, he's saying they've never done a study on this where they've kind of, you can give drugs to people that make them vomit. There are herbs that you could give people that would make them vomit. So he's saying they've never really done a study to kind of determine, if we force people to vomit and we get this cascade of neurotransmitters going and we get the vagus nerve stimulated, we don't know what percentage of people's migraines would start to remit after we did that. It would be kind of an unpleasant study.
But an important caveat, vomiting often happens later in the attack anyway. So some of the relief may simply be that the migraine is naturally winding down. And no.
He's sort of, I'm not quite sure where he's going with this, because at the beginning I thought he was saying that the process of vomiting is stimulating the vagus nerve and that's a benefit to a migraine sufferer and that's contributing to the lifting of the migraine. But now he's saying, well, the vomiting usually comes kind of later on in the attack, and so maybe the migraine was going to lift anyway. So I'm not quite sure where he's going with this. I would say, do we know, has anybody really done the research to determine where in the migraine do most people vomit or whatever? In my clinical experience, I would say that it's a little hard to say that. All of this, all of his explanation here is going under the assumption that migraines are a neurological disease. He frequently uses the term migraine brain. So in other reels, he's posited that those of us who are prone to migraines actually have a migraine brain. Our brain is somehow different. And this concept has really swept the migraine community. When I first started working exclusively with women with chronic migraines 9 years ago, nobody was talking like this. But now, you can't go on TikTok or Insta or Facebook and not find a migraine influencer talking about the migraine brain and how we have a migraine brain and our brain is wired differently and our brain is, the migraine brain is just inherently, innately, congenitally more hypersensitive than, a non-migraine brain. And this is one of the main reasons why I started this, little series called Triggered with Dr. Leslie, because it has really, really galvanized me. Because if you, this kind of messaging is going to shipwreck people's health, okay? You and I do not have a migraine brain, okay? So let me talk about from what my framework is, which I think very easily explains why people get nauseous and vomit when they have a migraine. So a migraine is not a neurological disease. It's not a defect in your brain. You don't have faulty wiring in your brain, which actually this Dr. Painkiller, neurologist, medical doctor, actually said in a reel that there's faulty wiring in the brain of migraine sufferers. None of that is true, okay? A migraine is a hangover without the alcohol, okay? So when if somebody goes out on a Friday night and they overconsume and they wake up Saturday morning, what do they experience? Okay, so even if you've never had a hangover, maybe you've seen it portrayed in a movie. What do people experience when they poison themselves with alcohol? Well, they wake up the next morning and they got bags under their eyes and dark circles and they're all puffy and bloated. They've retained a whole bunch of water. Their face is blown up. Their head is pounding. They're very, very sensitive to light. Where are my sunglasses? Somebody close the blinds. I'm dying here. They're very irritable. They're very sensitive to noise. Will you quit tapping? Will you quit making so much noise? Can't you see I'm hungover? You're driving me crazy here. Be quiet. They're very sensitive to odors. Oh my goodness. What is this trash here? Somebody take the trash out. I'm going to puke because of these odors, right? They're very, very nauseous. They've been vomiting, right? Maybe before, in the middle of the night, they're vomiting the next morning, okay? So when we have become poisoned by a substance, okay, if somebody consumes too much alcohol, if they drink some sort of poison, if they eat, deadly nightshade berries, the body vomits, okay? When you have become poisoned, your body wants to get the poison out of your body. And so it makes you vomit, okay? Even animals, if they eat something poisonous, they will vomit, okay? This is not rocket science here, folks. When the body has been poisoned by a substance, nausea and vomiting is a pretty typical response. So this is why when you have a migraine, one of the very common symptoms that comes along with it is nausea and, in some cases, actual vomiting, okay? Because you are having an acute overload of metabolic waste materials and toxins circulating in your bloodstream, and your body is generating acute toxicity symptoms. I've talked about this on my podcast. I even did an episode walking everybody through this and reading the symptoms, reading various poisoning symptoms, okay? So going through different, typical poisons that people might be exposed to and what symptoms have been documented with that exposure. Those symptoms sound like a migraine, okay? This is not a coincidence. This is how the body operates. So nausea and vomiting, right? It's a protective mechanism. This isn't, if you want to talk about neurotransmitters and vagus nerve, you can do all of that, right? But it doesn't answer the question. Why did my body do this in the first place? The conventional answer is that your body is stupid, defective, broken. You've got some sort of screwed up brain that doesn't know what the heck it's doing, and so you're vomiting for no reason. That couldn't be farther from the truth. And I want to go a little deeper into this because this is also something that people are not putting the pieces of the puzzle together. So you have to have enough vitality to generate symptoms. I've also talked about this on the podcast. So in order to generate symptoms, whether they're allergy symptoms, cold symptoms, cold and flu symptoms, migraine symptoms, the body has to have enough energy to actually do that. So it takes energy, it takes vitality to generate symptoms. So when people first start getting migraines, what's very common, it doesn't happen all the time, but what's very common when people first start getting migraines, the attack, I'm getting a migraine, right? And people will get a sort of profound migraine. Their head really pounds. They're really nauseous. They're vomiting. They're having a loose stool, right? Again, loose stool, we're flushing things out of the body. That's what the body wants to do when it's been poisoned. It's like, get everything out of here, right? So nothing more gets absorbed. So we're vomiting, we're running the bathroom, right? The body is supposed to do this when it's been acutely poisoned. So when people first start getting migraines, many times those first migraines, they're really severe. They're like, holy cow, what was that, right? I was like, my head was pounding, I was in the bathroom, I was vomiting, right? And then, oh wow, okay, I'm better, right? The first stage of migraines is usually a pretty severe attack, but we're coming through it pretty quickly. It's a couple hours and then we're like, oh, okay, great. Whew, what was that? I'm good to go now, right? And so that's a body generating that sort of extreme response. That's a body that has a lot of vitality because it's like, oh my goodness, I got a toxin overload in here. We got to handle this right away. And the troops are rallied, right? There's a good response that's mustered by the body to take care of the problem. Problem solved. Okay, bounce back. I feel better. What happens to people is over time, because they don't realize what's going on, so they're not taking action and they're not addressing the problem. What happens to people is the toxin load, the underlying toxin load in the body accumulates and accumulates and accumulates. Their vitality becomes diminished, okay? They're taking medication, they're starting off with Advil or Excedrin, then they're moving on to prescriptions. Ultimately, preventatives, they're adding more toxins from the drug, so they have more of a load from that. And the body can't generate the same level of response. So the overload is still there. The body wants to robustly handle the situation, but it can't. It doesn't have enough vitality to do that. So now instead of, wow, man, that was a crazy 2 hours, but hey, I'm up and at 'em, it's, oh my goodness, my head is hurting for 3 days, right? It's like, will this ever lift? We even call it a migraine hangover. Why do we call it a migraine hangover? Because it feels like a hangover. It's like, oh yeah, okay, I'm not like dead to the world, but man, I still don't feel good, right? The migraine drags on and on and on. If we had more vitality, we'd be able to muster a more robust response, and the body would be able to do what it needs to do to process this toxin overload, and we would feel better a lot quicker. When you vomit, again, I was young once. I overconsumed alcohol. I have vomited, right? It's like, right, you get a 22-year-old at Summerfest, and they overconsume Milwaukee's finest, and then they vomit, and they go, oh, good, I'm good to go, right? I feel so much better now that I vomited. It's because you're not continuing to bring that poison in. So, yes, if you have food in your stomach and you get a migraine, your body wants to get that food out of there, and you vomit, and then you're not absorbing toxic byproducts from digestion because you got the food out of there. Okay, that's it. Yes, it helps make you feel better. Absolutely, it's going to help make you feel better. The vomiting is a mechanism to remove toxin load out of the digestive tract, rotting food out of the digestive tract. But if you have to have enough vitality to vomit. This is the thing. So a lot of migraine sufferers will say, when I first started getting migraines, I used to vomit all the time. I get a migraine, I vomit, right? Oh boy, I haven't vomited in years, but I have this horrible nausea. I have this horrible nausea that's just terrible. But I haven't vomited in a long time. Sometimes I wish I could vomit. Maybe I would feel better if I could vomit. Right? This is so common thing that migraine sufferers say, because to get that vomiting response, you have to have enough vitality to generate the throwing up. So then people get stuck in this lower level nausea that's just so terrible, and they wish they could vomit. That's what's actually going on here. When you look at migraine through the framework of you're experiencing an acute toxin overload in that moment, and then your body is doing what it does when there's a toxin overload. It doesn't matter whether it's alcohol, whether it's deadly nightshade berries, or whether it's just migraine, right? It's like, well, what are you talking about, Dr. Leslie? I haven't had alcohol in years. I can't even drink without getting a bad migraine. Yeah, I know. You have an accumulated toxin load that you're carrying around all the time, that you're unaware of. And the migraine, what the migraine is sort of the final straw that your toxin bucket you're walking around with is totally up to the top, and a migraine is when that bucket tips over. The toxins spill out all over the floor. You have a rush of toxins into your bloodstream from that bucket. Hi there, I want to jump in real quick and tell you about my client Beth. She was getting 15 to 20 migraines and headaches per month, and as you can imagine, this was impacting her work performance and her confidence. She also has 2 small children, and she was starting to feel like she was a horrible mom because she had nothing left for them at the end of the day. But she reached out and she booked a free consult call with me, and after I asked her about her migraines and her health history, I felt confident that I could help her. I help women uncover the root drivers of their migraines and follow a step-by-step plan to dramatically reduce the frequency by up to 90% without adding more medication or taking a bunch of supplements. So we built her personal migraine map, followed the plan, and now she will get 1 to 2 migraines per year, which she uses ibuprofen to treat if she needs to, versus up to 15 to 20 per month when we first started working together that weren't responding well to any medication. She just reached out to tell me that she got a promotion at work, she's on top of her career again, and has been able to come off all of her migraine medication. But most importantly, she's a confident mom again, and she's attending birthday parties at Jump Zone with her kids and saying yes instead of saying maybe later. I've worked with women like Beth from all over the United States who were told, this is the best we can do, but they were still willing to dig deeper. So if you're serious about changing your migraine story, go to drlesliecaesar.com/apply or tap the link in the show notes, and on our free consult, we'll map out why your migraines keep coming back and the first 3 steps you can take over the next 30 days. I do cap new client spots each month, so if the calendar is full, the doors are closed for now. But if you're done feeling helpless and ready to do the work to heal, pause this episode for 30 seconds and book that consult call now. And you're experiencing the accompanying the normal toxicity symptoms that people get when they've been poisoned by something. It's just you were kind of carrying that around all the time, and then that migraine attack is when it all spilled out, tipped over, versus, oh, I had, 10 shots of whiskey. Oh, I ate these berries in the woods and they were actually poisonous. So that's actually what a migraine is. So it would make a lot of sense that you would feel nauseous and vomit in those conditions. Your body is just doing what it does when there's a toxin overload. So yeah, vomiting in that situation, for most people, they're going to feel better, right? Just like if you drank a bunch of alcohol, if you ate a bunch of poisonous berries in the woods, your body's going to want to get that out, and it'll help you feel better, as unpleasant as it is. So, I'm sure he's going to continue to go on here and talk about, how your brain is defective and it's not wired properly and you have a migraine brain and everything else. Please, that's not the case. If that were the case, I'd be laying in bed right now. I wouldn't be talking to you. I wouldn't be triggered. I would have been triggered and gone into a migraine, but I wouldn't be triggered here by these reels. You can recover from this just like I recovered from it, just like my clients recover from it. This is, it takes work. It takes expert guidance. That's what I've been developing over the years. I have a great deal of expertise in this. So I'm not saying it's easy. I'm not saying, you just take some sort of miracle herb from the Amazon and you're going to feel better. It takes real work. It takes real understanding of what the particular factors are for you that's driving this. But at the root, that's what's going on here. And that's why you're experiencing these symptoms. You're experiencing toxicity symptoms when you get a migraine. That's what a migraine is. It's the same types of symptoms that you get if you overconsume other toxins like alcohol, or you are poisoned by arsenic or strychnine or nightshade berries or whatever. It's the same type of symptoms that the body generates when it's been poisoned. What you just don't realize is you're walking around with a high level of toxin load, and when it overspills, when it finally overflows and dumps everything out into your bloodstream, that's what a migraine is. And your body, in its good design and its wisdom, sort of mops everything back up after that and tries to put it back into the bucket. And that's when you actually feel better. But then your bucket is still up to the top. So then any little thing is going to tip it over again. And then you're going to go through the whole thing all over again. We got to get the bucket drained. That's the solution to this. We've got to get the bucket drained. And then you've got room for extra. You've got room to inhale some perfume molecules. You've got room to eat some MSG at a restaurant, right? You've got room that you can put some additional toxins into that bucket, and you're still going to feel okay, and it's not going to tip over, and you're not going to continue to go through all of this. So I hope that helps. Like I say, it's when you understand what's actually going on here, it makes a ton of sense, and you don't have to talk about all this fancy biochemical terms and so on. So hope you enjoyed it. I'm sure you will see me soon, because I'm sure I'm going to get triggered again soon by some of these reels. I will talk to you soon.